When you think of medical equipment, what comes to mind? Sleek, shiny, computerized machines? How about a dialysis machine made from a milk pail and plumbing parts from Canadian Tire? The latter is the kind of equipment you'll find at the Museum of Healthcare in Kingston. And in this next installment of our Places of Ontario series, curator Mary Dunn is here to tell us all about the museum. Mary, welcome.
Thank you.
So how old is the museum?
The Museum of Healthcare is actually a relatively new museum. We started a collection in 1991, so we're only about 13 years old now.
Ah, okay, but the stuff in it is very old,
The
right?
stuff in it is very old, yeah. I think the oldest thing we have is from the 1700s, and it's a tooth extractor. So the strength of our collection, though, is the 19th and 20th centuries.
And now I've heard of the Anne Bailey building. What was the original use of that building?
Well, as you know, that's the home for our museum.
Yes.
But the original use is actually a National Historic Site at the moment because it's one of the oldest purpose-built nurses' residences in the country. So basically, this building was built to serve the School of Nursing at Kingston General Hospital, which started in 1886. But this building was built because initially the nurses would have been living in the hospital, sort of cheek and jowl with the patients and the doctors.
Right.
So when they built this wonderful structure, it was a recognition of nursing as a profession.
Okay, and who are these people?
These people, that's one of our volunteers, Christine Spafford. She's also a KGH nursing alumni, and she's dressed in a period costume from about 1904. And on the left is our one of our summer students from last year, Andrew.
Okay, and that would be one of the rooms?
That's one of our exhibits. That's our potions, pills, and prescriptions exhibit.
This sounds like Harry Potter now.
Yes, a little bit. But that's actually a makeup of a doctor's office in the early 1900s.
Ah, okay. Now I know there are also other historically important buildings, right, that are connected to the museum.
That's right. We're part of a complex of buildings that are all part of Kingston General Hospital. This is one of the oldest hospitals in the country. And it's actually got the only remaining, right there, we've got the only remaining Victorian surgical amphitheater left in Canada. So every teaching hospital at one time or another would have had one of these. It was basically to teach medical students and to let them observe operations.
Were they all constructed in that amphitheater kind of?
That's the typical design. That's right. They're round.
Okay.
So on the inside you would have had 3 rows of seats. There were about 100 seats to allow a good view of the operation.
Wow. What about another purpose that Kingston General served?
Another purpose was that the main building, which is also the main public general hospital built in 1835, between the years of 1841 and 1844, served as Canada's Parliament building when Kingston was the capital, of Upper and Lower Canada. So
lots of history.
Lots of history, yep.
Do people get a guided tour?
Actually, yes, we do run a guided tour of historic Kingston General Hospital, usually during the warmer summer months, but those hardy souls who would like to go can always just give us a call and we'll take them.
Okay. Now, I came across so many interesting things about your museum.
Right.
Tell me what a patent medicine is.
A patent medicine, these were basically made in the mid-1800s to the, early 1900s, and they were medicines that were manufactured and there'd be wild claims associated with them that they were cure-alls, basically. So they were claimed to cure a range of problems, diseases, dysfunctions, all sorts of things. And the big problem with them is that they didn't really list their ingredients initially. So a lot of them had a high content of opiates, alcohol, there was mercury in some of them, and people didn't really know what they were taking. So during about 1920, they actually started regulating how they could advertise and what they could put in these medicines. But there were people who died from taking patent medicines, unfortunately.
Well, that makes me wonder how we got to use the term patent in its meaning today.
Yeah, I'm not too sure where the origin of that is. But
that's very interesting.
Yeah.
And what about medical equipment back then? Were any of the medical, any of the equipment used, were they as useless as these patent medicines, I'm wondering?
Well, there was also, as medicine was almost sort of becoming professionalized during the 1800s, there were, of course, as well as becoming professionalized, there were also kind of separated from those were kind of quack doctors. So some quack doctors or people who manufactured devices that people claimed would do things to improve your health, but really did not. And one example is our violet ray generator, which is a new donation to the museum that we'd received. And it basically produced violet ultraviolet light, and you had to put the attachments to various body parts, and it was supposed to cure you of various illnesses. But of course, there was no proof that it really did anything.
That it really worked. What about, was any equipment dangerous, actually dangerous to people?
Oh, certainly. Another spin-off of sort of that kind of medical technology was the shoe-fitting fluoroscope, which many, that's it right there. Many shoe stores between 1920 and the late 1950s would have had these, so I'm sure some people watching remember these machines. And basically they knew from when they started using x-rays that they were harmful, but for some reason these machines were just put into public use and not really regulated. So there was an x-ray tube at the base of that machine that the salesperson would push the button and it would start working, and the parent of the child who was having their shoes fitted could look into one viewer, the salesperson could look in another, and the own child would put their feet into that little hole there, and they could take a look and see how their foot looked in the shoe. But of course it's emitting all kinds of radiation right into people's faces, and so that could have been quite harmful.
And do we know when that was stopped?
They stopped using them, I think, in the mid-1950s. To 1960s.
And what about the equipment in your museum that was functional, you know, served a purpose? What would we see?
In our museum, what kind of machines would we see? One example is the King Med kidney, and that was one of the earliest, as you mentioned in your introduction, one of the earliest hemodialysis machines used at Kingston General Hospital. This machine was used in 1967, was when it first started being used. And when dialysis was starting to be used in Europe in the 1950s, and doctors sort of knew about it, but manufacturing these machines couldn't keep up with demand. So a group of doctors and engineers in Kingston came up with this plan, and they built this machine in a little workshop in Portsmouth Village, which is just next to Kingston, and this was made for a total cost of $500.
Oh my goodness! And so we weren't kidding when we said parts from Canadian Tire.
Plumbing parts from Canadian Tire. That's absolutely right.
And I see the old pail there, the tin pail.
That's right in that circular opening there. It's a stainless steel milking pail. So
wow. What about, you also have the surgical saw, don't you, from way back
when? Yes, we have a few surgical saws. They came in different sizes. The one shown right here is made likely after 1880, and the reason I say that is that it's got a metal handle, so if you see medical instruments that had wooden parts, they were probably made before then, because of course by this time they knew that you had to wash and sterilize your instruments to prevent cross-infection and things. So it's actually got a detachable handle there. But that probably would have been used for smaller body parts, so cutting off fingers.
Okay, moving on.